Hi everyone. Thanks for joining us for the Stroke Special Interest Group Clinical Pearl video of the month. With a focus this month on caregiver burden after stroke, we interviewed 3 amazing women who have graciously agreed to share their story and their perspectives about being caregivers to their husbands after they had suffered a severe stroke. You'll see some similarities in their answers and some differences, but I think that you will find that their information and their perspectives can only make us better physical therapists.
My name is Annette.
And how long have you been a caregiver?
For 2.5 years. I'm not able to do anything that I used to do. His hunting, his walking, his hiking, working in the yard, cooking, things like that.
He had a hemorrhagic stroke and it has left him very debilitated. He, at one time, he wasn't even able to sit up on the edge of the bed. He still has silent aspiration, so he still has his feeding tube and a certain amount of dementia with him. It affected his left side. You know, he's still not walking independently. He's not doing anything independently.
In the hospital, he ended up being completely left side affected, where he couldn't stand, he couldn't hardly sit up without listing. He did not go home at first. 3 weeks in inpatient rehab. Kind of mostly wheelchair bound. We took the wheelchair with him everywhere. His cognition was fine. Didn't have any problems thinking, making his needs known, speaking. That was all perfectly kind of where he was before. And 5 years out, he still has foot drop.
He's hunting, he's driving.
He's
So he still has some issues with that arm.
Yes.
Is he using that arm for fine motor kind of things?
Not fine.
My husband was in the hospital. There was so many people coming up, and it just felt like all this support. And then you get home, and nobody comes. And you know, for me, I needed it more than he did. I think is my fear of not being able to take care of him. You know, I'm not getting any younger. Keeping him safe, and most importantly, and I know that sounds maybe selfish, but most importantly, keeping myself safe.
Forcing him to do his exercises at home, not feeling like I'm a nag to get him to do them every day. And then if I give in and not do it, then feeling like a failure to him because I let him get away with not doing them.
A lot of it was, I had to try to, how can I push him to do the most he could be and yet not be a nag, and because I'm still his wife. I don't want to treat him like a child. On the other hand, I want to treat him like a child. Just jump in and help Jim. I'm his wife. I'm his love. I'm not his nag. I'm not his caregiver. And that's really hard for me because I want to jump in. So it's a balance. I think for support, I think my own family and my coworkers, I mean, they were amazing. As time went on, I'm kind of an introvert, so books and you know, anonymous Facebook support groups and stuff like that. We did go to one support group one time, and it was pretty nice. Jim liked it. Yeah, like on Facebook, there's a couple of stroke things, and it gave me some ideas, but it also gave me a sense of just how blessed Jim was through his time of stroke and how I am, because stroke is a devastating thing.
And where do you find support?
Here at therapy. That's the biggest. The other patients, all of the therapists, that's the best support.
As far as what I would recommend, what I would love to see, this person comes to you and gives you, here's all these resources that you can go to, not just for your treatment, but also for support, for help around the house, for rest, for activity, just everything. And I would love to see like something of that effect, a stroke type of a navigator, that the patient has a stroke, they're in the hospital, somebody can come to them and tell them all the resources available. I had no idea.
Home support, can you come home with us? Because it's wonderful to be here at therapy to get the support and have the moral encouragement, but then you get home and you're all on your own. So I don't know, because you can't take your therapist home.
So I think one of the most important things and should really focus on before a caregiver takes somebody home is not only their ability, and make sure that they have had the opportunity to try to do the transfers. And the more you do it, the better it is. But not only those kind of things, but to impress upon the caregiver how important it is to take time for themselves. It's like the stewardess that when the plane's going down, she puts the oxygen mask on herself first so that she can help all the other people.
What a great analogy.
And I think that's really important. I'd like to say my husband comes first all the time, but there are things that I need 3 hours, 3 days a week, that I do something for myself and have somebody come in and sit with him. And I think that's really important because I don't resent my husband. I don't resent having to be home with him. So I think the one thing you can stress is you're not neglecting your loved one by taking time.
I think you mentioned the word health, the partnership. I like the idea that including the caregiver as a partner in the whole treatment plan. Ask them. You can ask my husband all you want what his goals are, but if you would turn to ask me, I think I have another set of goals that he doesn't think about so much. The caregiver, and include them in part of that treatment plan. He would acknowledge maybe that there is a little bit more on that caregiver.
Is there a role or a situation in which you think it's appropriate to pull that caregiver aside and say, how are you? How are you?
I think that'd be excellent. I think that would be excellent. Nobody has ever said that to me. Jim home with a whole list of stuff to work on and make sure that your caregiver gets on him for that. You know what? That's just another pressure.
From a physical therapy point of view, just because you're using a slide board with two people that know how to use that slide board in the rehab facility, and that's what's working for you.
So when we think about discharging home, we need to think about teaching you alternatives. So instead of just the one way we think is safest for you, but what happens when that situation doesn't occur or you're not successful with that one? We need to teach you several ways to do things in case the one we thought was going to work isn't going to work. You think that would be helpful?
I think when it was time to move him out, he's no longer could stay in the rehab facility. And I said, well, he's coming home with me. Having different people telling me different things.
Be sympathetic, help us laugh, because otherwise we cry a lot. So the laughter helps.
It just seemed like the therapists were bent on, okay, see if you can move this muscle, see if you can move that muscle, can you hold this, can you do that? And they weren't really like involved. They didn't ask, what are your struggles at home? And how can we like tailor our therapy to handle that? Get that. Just say, what are your struggles at home? What are you finding that you need help with? And then let's tailor our therapy to work towards that. We still need to work on those fine motor. We still need to hook you up to the E-stem. But while we're doing that, we're thinking about holding a toothbrush and writing the alphabet and writing with you. I hope they recognize that I am not going to take this list and go home and work as hard as you did this last hour for the next week. I can't, but we will do the best we can.
The encouragement, I'm my husband's encouragement. And I think I need that too, that I know that I'm doing it right.
Going to therapy myself after falling apart, trying to internalize taking care of him and letting go of what we thought our future was, and knowing that now I'm the caregiver, he's not the caregiver, I have to take care of everything. Getting to a therapist myself.
Where it's like, well, you need to do this at home. Well, do you know what I do at home already, So sometimes it's like, I'm bringing him here because I want you to do those things. And I know there's certain things I need to do at home for him as well, but sometimes just putting that one more thing. But we just can't spend every minute of every day doing therapy. His caregiver, I'm his wife, number one. I want us to have husband and wife too. Well, I think for most of the whether they're students or the people that we've worked with in a neural situation, I think you guys have it. I really do. I have so much respect for physical therapists, and I'm not just saying that. I really do. I mean, you guys get it. I mean, it's like, I don't think anyone's ever not asked me, what are your needs? They always want to know, and how can we help you?